My vision is that every single person in every single surgery should have PT as an option to optimize outcomes. We can make everyone's post-operative experience better if we start caring for them as soon as they leave the operating room.
So tell me a little bit about what you recently gave a presentation on.
So I was asked to give a presentation very generally about fourth trimester, but I felt like that was a very vague request. So I broke it down into different categories of kind of taking the group from acute care to about 6 weeks postpartum, so that everyone in the room hopefully felt like they could start to put postpartum, peripartum PT into their PT narrative. Everyone has a narrative about, who they are, what they come from, what they focus on. And so he got me kind of fired up this week. But in terms of the narrative, right, we all have our narratives, our stories that we tell, our myths that we tell about our own identities. And so many people feel that, the Black experience is not part of their narrative, right? They are able to say, well, that's not me. That's not my experience in the hospital. That's not how my sister, brother, family member had. That's not that. I don't see that. So, especially for these younger PT students, I wanted to get them excited that there is a whole area and whole group of people of all races, of all backgrounds that need our help. And it's not a choice, it's a pretty imperative if we really want to be treating the whole person and of all people equitably.
Noah, I walk into a hospital and I'm married and I have support at home. I have a nanny that's going to help me take care of my baby. And I really don't think I need a physical therapist. Do you think that the hospital should accommodate others who may not fit my narrative?
If we standardize everything, if we standardize care, standardize even trauma screening, right? So someone may come in and may check all the boxes, but you never know. And then, in terms of if it was you, right? Clearly, we're living in different skin colors. We're having different experiences day to day. Your allostatic load is going to be different from my allostatic load, right? And this is where I feel that too many people are uncomfortable talking about race, right? And they're very uncomfortable accepting the fact that we live in a society that is founded in white supremacy, colonialism, right? We need to start having these discussions and start dismantling that in order to have a more equitable future. So if it was you with your partner, I'd still say you still, based on statistics, the outcomes for you are going to be more likely worse than someone else, despite the fact that you check all the boxes in terms of, having all of that, all of those, things that you mentioned, being supported and having a partner and all of that. Yeah, so I think that if we just keep it standardized, then yes, everyone should have that opportunity.
No, if the majority of physical and occupational therapists are white and represent maybe middle and upper middle classes,
Yeah.
why should they care about a small percentage, relatively small percentage of patients who may not have the best outcomes in the maternal health population? With overall, as a nation, we're not tracking too far beyond other high income nations.
Well, we're actually doing pretty poorly relative to Europe. It doesn't matter what race you are. And we are spending more in the, consequences of not investing in our, you know, in our healthcare. we are not investing in our people. We are not investing in a lot. And so what we end up seeing is the downstream effects of that and the consequences in our hospital system, in our medical systems. This includes outpatient as well. So if we don't, I think we all suffer. And if we do, then we all benefit. We end up having, we are trailing, I don't know, remember how many European countries, at least 16 European countries in terms of mortality. Now it's not getting any better, and it is getting better over there. And it isn't, it's because we aren't taking care of each other. We need to do a better job understanding that, as we say, no one can be free unless all of us are free, right? So it is about understanding that our strength comes from our diversity.
What advice or what recommendations would you give to an acute care therapist who says, I want to help this population? I'm so in line with your message. However, we do not have enough resources or staff to really serve those individuals on the maternity care unit. What would you say?
I think that there are ways to start building bridges. So, for example, could it be that I'll give it a kind of an out of this context example that Dr. John Powell came up with. I was referring to in one of his speeches on belonging. And there is a cafe in Tel Aviv where you got 50% off of your entrance fee if you brought a Palestinian friend with you. So I feel that, we could absolutely make differences if we incentivized it a little bit differently, a little bit more creatively. And that's the beauty, I think, for a lot of pelvic health therapists, especially. We went into it because we love the creativity. We love being able to look at an entire person holistically and think, okay, is this coming from this part, or could it be the feet? Could it be the balance? Could it be stress? Could it be other psychosocial factors? And we need to hone in on that creativity to start building bridges with other people in that hospital system. There are ways to do it, and there are ways that those in power can start to make space for that. Whether that means, someone at the top, I could say, let's say the APTA says, okay, we want such and such to happen. I just want every single person here to you get this amount off of this particular conference if you come in with a story from someone who's benefited or needed to benefit from a physical therapist during their peripartum period. I mean, that's just one example of thousands, but we can create those bridges, and these are systemic issues. And I say this every day. Individuals cannot solve systemic issues. It is the system that needs to change. And it is too much to ask of us individuals every day to try to solve these systemic issues. And that's where the burnout happens. That's when, why at the end of the week, I am done, because I feel like I am taking on these systemic issues. And this is why I'm so grateful to the Pelvic Health Network, where we're not doing this on our own. We are trying to create these bridges so that we can make these systemic changes and build bridges with other organizations, whether that's occupational therapists, that's urogynecologists, that is gynecologists, these are nurses, midwives. There are so many bridges that we can build. And then with that, we'll be able to make a little bit of a dent in those systemic changes. We talk about diversity, equity, and inclusion. And one of my friends was saying that there is a problem with inclusion, because when you think about inclusion, we're deciding who's included and who's not. and there's going to be a gatekeeper, right? And we don't want to be, I don't want to be that gatekeeper. We need to change it. And I think we can use the word, if we think about our neighbors to the north, universal, right? Everyone has these needs. If we think about every single person who gives birth has needs. Doesn't matter their skin color, doesn't matter their background, it doesn't matter their zip code. Every single person, after giving birth, after a C-section, after any surgery, has needs. And if we think about the universality of that, right? Health is not just how well you are functioning, it is also healing. That is an integral part of what health is. And if pain is part of our journey as human beings, we need to work on healing from that pain. And that's where we come in as physical therapists, coming from a biopsychosocial framework, understanding that we are not going to pathologize a certain biomechanical flaw that we see and say that that is the source of their pain. We have so much 20 years worth of research to show that it is nothing, as far as we can tell. There is no good research to show that, if you move your shoulder one way versus another way, that's going to reduce pain. It is so much bigger than that. And if we're going to move forward as a profession, we need to, again, see that these are universal needs, that certain people don't deserve more than others. We're not a boutique practice that only certain people who can afford shoulder, hip, knee replacements can access. We are a group of people that can help every single person along their lifespan.